Female Continence Physiotherapy Pathway is a physiotherapy-led service for the management of patients with women's health and urinary incontinence conditions. The aim of the pathway is to provide specialist advice and treatment for urinary incontinence, vaginal prolapses, postnatal problems and specialist pelvic floor dysfunctions, such as weakness, pain and lack of sensation. Please see the educational section of the website for a full list of conditions that are accepted onto the pathway. The pathway aims to ensure appropriate links between primary care, community services and secondary care. The pathway will accept referrals from GPs, secondary care hospital consultants, the community continence service or self-referral. This can be done via paper referral or by issuing the patient our self-referral card, and they can complete this on the internet or via the phone. Within the pathway there is scope to refer onwards to the community continence service and secondary care as appropriate. The service does not accept referrals for the following conditions: patients under the age of 16 years, patients with a neurological condition requiring specialist neurological physiotherapy, microscopic hematuria, patients unable to give informed consent, and pelvic masses. Urgently refer women with urinary incontinence directly to specialist services who have any of the following: neurological emergencies, for example, inability to pass urine and saddle anaesthesia, microscopic hematuria in women aged 50 years or older, visible hematuria, recurrent or persisting urinary tract infections associated with hematuria in women aged 40 years and older, suspected malignancy mass arising from the urinary tract. Please see the educational section of the website for a full list of further indications for consideration for referral directly to specialist services. Urinary incontinence is a common problem among adult women with a wide range of severity and nature. The most common presentations are stress, urge or mixed incontinence. Please refer to the educational pages of the website for further information on all these conditions. Prolapses can be classified as anterior vaginal wall prolapses, known as urethrocoel or cystocele, posterior vaginal wall prolapses, known as rectocele or enterocele, prolapse of the cervix or uterus, and prolapse of the vaginal vault, which can only occur after prior hysterectomy. A woman can present with one or more of these sites. The education section of the website provides information on all these conditions. A woman with prolapse might present with one or all of these symptoms: vaginal, bladder, bowel, back, abdominal, and sexual symptoms. All patients presenting with urinary incontinence should undertake a urine dipstick test to detect the presence of blood, glucose, protein, leukocytes, and nitrates in the urine. Where appropriate, the use of overactive bladder drugs and topical estrogens can be discussed. Patients should be referred onto the pathway to physiotherapy for a full vaginal assessment and a trial of conservative management. Where no red flags are present, the first line of treatment should be a trial of physiotherapy. Following a referral, the patient is seen within 15 working days by a women's health specialist physiotherapist. All patients are sent an advice leaflet prior to their initial appointment. The initial appointment will be for 1 hour. During their initial appointment, where clinically indicated, the patient will receive a full vaginal assessment. At the end of the initial assessment, the physiotherapist and patient agree and document a care plan. Physiotherapists will provide pelvic floor exercises and education on bladder control, diet, weight loss and lifestyle modifications. The patient usually receives a minimum of 3 appointments. The aim of the physiotherapy programme is to support the patients to manage their conditions. If a patient completes the 3 months of assessment and treatment and their symptoms are resolving, they will then be discharged from the service to continue self-management. The patient can self-refer back to the service for assessment should their symptoms deteriorate. Pelvic floor muscle exercise is particularly beneficial in the treatment of urinary stress incontinence, with studies showing up to 70% improvement in symptoms. This improvement is evident across all age groups. Research has shown that one-to-one pelvic floor muscle training is effective for improvement of prolapse symptoms. Our specialist physiotherapists regularly attend multidisciplinary meetings at the West Suffolk Hospital where complex cases are discussed. If required, the physiotherapists are able to refer directly to the urologists and gynecologists at the West Suffolk Hospital. We will keep you informed of your patient's progress throughout the pathway. It is estimated that pelvic girdle pain affects up to 1 in 5 pregnant women to some degree. Physiotherapy aims to relieve or ease pain, improve muscle function, and improve pelvic posture and stability. If pregnant patients are presenting with pain over the pubic bone at the front in the centre, across one or both sides of the lower back, or radiating down the leg, they should be referred to physiotherapy. Physiotherapy will include education, especially on exercise, posture, pacing, pain relief and lifestyle modifications. Some patients may require education and advice on equipment, for example, pregnancy support belts or crutches. Manual therapy may be required and used if appropriate. Patients are asked to complete outcome measures which include EQ5D, Incontinence Impact Questionnaire, or the Pelvic Organ Prolapse Symptoms Score, which they are asked to complete at the beginning and end of their treatment.